COVID-19 and cancer. Winter is coming. So for those who've seen the show, they know that theme. The basic premise for those who haven't seen it is that there is an Ice King and these White Walkers beyond the wall that are coming to inflict death and suffering to the people of Westeros. Now, some people, A, don't believe that they're real. B, they don't really care and they think they're not going to be affected. Or C, they're trying to take advantage of the whole situation. And there are those who have actually seen the White Walkers and are trying to warn and unite everybody against the coming danger of winter. Does that sound familiar? So being a cancer doctor, I have a special interest in this particular topic. Let me tell you though, winter is coming. The SARS CoV-2 virus and the influenza virus will be coming back in the winter, whether you believe it or not. Is it going to kill thousands? Is it going to kill hundreds of thousands? We don't know. But the point is, you have to prepare. This is what I'm telling all my patients right now. Prepare. You have 5 months to prepare. The data changes daily, but what we've seen so far is this. People with cancer have a 2 to 5 times higher likelihood of having a serious case. The ones that have the highest risk with cancer are those who had lung cancer and leukemia or lymphoma. But all cancers have a higher risk. This makes sense, right? The immune system is involved in both cancer and fighting infections. So being open to cancer may make you open to having a virus. Number 2, regarding treatments, those who receive immunotherapy, surgery, and chemotherapy have the highest risk if you have cancer. Radiation didn't have a higher risk, but being a radiation doctor and anybody who's had radiation, you know that your body's not right after taking it. So I don't necessarily believe that part of it. 3, people who have had cancer history, meaning they've already received treatments and they're recovered, they also had a higher risk. That makes sense, right? You're still recovering from the treatment. But also, when you finish Western treatment, you're not given any techniques to improve your immune system. That's why I wrote my book, Healing Before You're Cured, to give you those techniques. But they're also in all these posts I've been doing. 4, comorbid conditions, things like hypertension, diabetes, heart disease, COPD. These 4 actually, and of course obesity, number 5. These 5 things with cancer give you a much higher likelihood of having a serious illness or even death from COVID-19. So what to do, right? You got 5 months. Winter is coming. You need to prepare. Do all the things that I've been talking about, all these posts. Get your diet tuned up. Get your exercise going if you can, if tolerated. Try to get it up there to sweat-producing activity between 3-4 hours a week. Also, from now to eternity, please do rigorous hygiene. Wash your hands. Do all those things that we've been talking about. Stay away from crowded areas, right? Reduce all sources of stress. Add meditation, add journaling, everything to your regimen. Get all these things going. Get the ones that make you stick and get them going. Now, as far as supplementation, I personally don't think the data is there right now for supplementation for COVID-19 prevention. And it's not out at all. There's been no recommendations from the CDC. But I recommend people get all your vitamins from food. You can get vitamin C, vitamin D from foods. You can also get it from the sun. A small dose of the sun will do the vitamin D conversion. And also for those who are already supplementing with vitamin D, know that you can overdose on vitamin D because it's a fat-soluble vitamin. Number 6, surround yourself with people who have the same perception of the virus as you. If people around you don't believe that the virus is real, they're going to subject themselves to more risky behavior that puts you at risk. So be aware of those people, even in your lives. They might be your family members. And if you're afraid of missing something from the news, like I always tell you, stop watching the news. Sign up for the Health Alert Networks. In Los Angeles, it's called LAHAN. Just Google LAHAN, Los Angeles Health Alert Network, or in New York, HAN. They are both really good sources of facts and recommendations. And the last thing is, be cautious, but don't worry. Caution is born of self-love. Worry is born of emotionally driven fears. Okay? Whether you believe the White Walkers are coming right now, we need to be cautious. because we don't have a treatment. In terms of Game of Thrones, there is no dragon glass, right? But we can do what we can, prepare ourselves. Now, I wish everybody in Westeros was united against this threat, but you know how those Lannisters are.